So there's different breathing techniques that can be used, many different ones. So so this is our pain assessment scale, but remember if we're talking about labor, it's actually the coping scale. So probably I need to change this slide here. So it's the coping scale, red, yellow, and green light. And we talked about that during lab or during clinical. So the red light is she needs a lot of help, and the help might come in the way of medications and or position changes or breathing techniques. So in yellow light is, well, maybe she just needs to change positions more often. In green light, she's managing just fine. So the pain assessment scale in this manner, we would use postpartum versus in intrapartum. Okay, so where was that? Oh shoot. Now we gotta go back. Okay. So this slide is about your history of pain. How do you manage pain? Do you scream when you have pain? Is that what you do? How do you? Okay. So how do you manage pain? Do you take medications? Do you do alternative measures when it comes to pain? So everyone handles pain differently. What do they usually do? That's what I would ask them. What do you usually do when you're in pain? Some people are very quiet and don't say a word, and other people are very vocal and very verbal when it comes to pain management. So there's different coping mechanisms to it. And what about the support systems? Who is there with them? They can be very helpful. Is it mom, grandma? Is it the significant other? Or is it just the nurse? Those people can help the patient to manage the pain as well by doing breathing techniques with them, assisting them to change positions, uh, providing the nurse, if it's the nurse, she can provide medications. What you want to do is inform your patient of what the options are for pain management. So there's what's called complementary and alternative pain relief. Complementary is, okay, so I given her some IV sedation, whether it be Demerol and Vistrol or Stadol and Phenergan, but she needs a little something else too. So let's do some effleurage. Let's do some breathing techniques. So along with that. So the lab also the patient might bring in her own labor coach, which is called a doula, or she might have her significant other as the labor coach, or you are the nurse. You're the labor coach because you're all she's got. So we can teach her relaxation techniques. Remember, the more you relax, the easier labor is going to go. Shut the room door, turn down the lights, play some relaxing music. Help the patient to focus. Focus on relaxing every muscle in her body. Focus on the breathing techniques, whether it's just breathing slowly, doing slow chest breathing, or breathing um, and not holding her breath. Because if you hold your breath, that just makes things worse when there's pain. Aromatherapy is also an alternative, things that smell good. Of course, we're in the hospital, but that doesn't mean you can't use things that smell good. Lavender lotion is one of my favorites, or even menthol. Uh, Menthol is a good one too, but mostly I like lavender. Using heat and or cold. Hydrotherapy. Students asked when we saw the bathrooms, can you deliver in the jacuzzis? No. but you certainly can stay in there as long as possible because it's a distraction and it helps with the relaxing. Okay, it makes it feel good, so it helps the muscles relax. You just can't deliver in the tub, which is very deceptive. Therapeutic touch. Think about if you just hold a person's hand, sometimes that makes them feel comforted, or just touch them on the arm. That's very useful because it it distracts from the pain that's actually going on. So there's narcotic analgesics, and we did talk about those, and we do talk about them those more in the lab that we had that has to do with comfort. Whoops. Narcotic analgesics have to do with, oh geez, I lost it here. Stadol and Phenergan, Demerol and Fistrol. We did have talked about those. Oh boy, this is fun. Are you awake now? All right, there we go. No, that's not gonna work. There. Um, uh, IV anesthetics. The patient can still feel the pain of the peak of the contraction. However, as the contraction goes away, they tend to rest between contractions, sometimes even fall asleep. So there's advantages and disadvantages to those. Epidural, which a lot of people want, not all people, but a lot of people want, and they take away the pain from the waistline down. However, there's still pressure that is felt as the infant moves or the fetus moves through the vaginal canal. So I guess what I should be showing you, hold on. Okay, we talked about narcotic analgesics like Demerol and Stadol here. Okay, pharmacologic agents. Okay, and then regional anesthetics are like epidural, spinal, and spinal. So epidural, yes, some people they think an epidural is going to cure everything and they're going to get through labor with no discomfort. Well, that's not true. Maybe less discomfort, yes, because they don't feel anything from the waistline down. Um, and it is very helpful, but you can feel the pressure as the fetus as it moves through the vaginal canal, which can be just as uncomfortable. Spinal is not given for oh, hold on. Spinal is okay. Um let me go back. Epidural, you get continuous pain relief from the waistline line down as long as the epidural is infusing. Okay, so with a spinal, it's a little different. The anesthesiologist places the needle, gives a shot of medication. It's a one-time shot, so you would hope that your patient would be like 6 or 7 centimeters because you won't be able to get it again and it'll wear off. And the advantages to that is um, the anesthesiologist is their advantage because they don't have to stay there the whole time. But it does relieve pain and of contractions. However, it's a one time thing. Nursing implications, as I said. So if this was your patient and she wanted an epidural, you would support the patient and assist the anesthesiologist. It's the anesthesiologist that places the epidural, same as spinal. You would just assist them, have all the things. As you saw in the hallway, they do have an epidural cart, so everything for an epidural is there. I don't think that Samaritan does spinals, but some hospitals do. Like if you were to go to Kraus, they may give a spinal versus an epidural. General anesthesia. So we don't like to do general anesthesia, and the reason for that is the anesthesia immediately goes to the infant. So as soon as the baby's born, it may have depressed respirations. It affects the fetus right away. And even though from the time of the cut, till the infant is out, it's usually 5 minutes, but that still can affect the fetus. So they try not to use general anesthesia. However, if the patient is uncontrollable or it's a true emergency, like she's abrupting or there's complications, even then they try to avoid general anesthesia, but it occasionally they do use it. So the disadvantage is that it affects the infant right away. So we want to monitor and know that if mom's getting general anesthesia, this baby's going to be affected. So we might have other individuals around to assist us and may have to do respiratory assistance for the infant. So pain related to labor contractions, that could be a potential nursing diagnosis as evidenced by patients screaming every 5 minutes when she's having a contraction. Um, so that can be real, and sometimes your patient, I have had patients that scream non-stop. They have no interest in following guidance or direction in how to alleviate that pain. And sometimes it's a matter of culture. Vocally and verbally, the culture of the people are very vocal and verbal. So you can educate your patient. Yes, this is what you can do. This is what we can try. And she may not comply, but you still given her options. And sometimes, no matter what you do, they're going to scream through the labor the whole time. You'll just maybe be a little deaf for a couple of days afterwards. Anxiety related to knowledge deficit. So make sure, no matter what you do to your patient, and put yourself in that position. If you were the patient and the nurse was putting something through your IV, asking you to do things, putting you on the fetal monitor, you educate her about those things along the way. And that will definitely help decrease her anxiety, which therefore would allow her to relax more. Okay, so there we have it, comfort measures.